He's a high achiever who is driven, passionate, motivated, and always engaged in the pursuit of excellence. For over several decades, Dr. Simon Keushkerian has been saving lives and helping people. Board certified in general and vascular surgery, he has expertise in treating diseases of the veins and blood vessels. Dr. Keushkerian possesses proficiency, stamina, endurance, resilience, problem-solving, decision-making, communication, and leadership skills. Dr. Keushkerian has walked a fine line on his way to the top and proudly continues walking that line. Dr. Keushkerian, what do you consider to be the most significant barrier to providing adequate health care?
There is no single answer to that question, but in my practice, I believe that the most important one is most likely for everyone, financial. There are others like transportation, linguistic, cultural. Financial is the one that bothers everyone because healthcare is free to everybody, available to everybody, and at the end you end up with a big fat bill that you have to pay. So the financial is the most important one for everyone, but then there are others like transportation issues. Linguistics, they like to see a physician who can understand their language and also understand the culture. So those are barriers that people try to get over, those barriers to get a good healthcare from people that they can trust, who will understand their problems.
What more can be done to provide equal access to healthcare?
Yeah, it's a good question because that's the answer that everybody likes to say in a way for those who have and for who does not have good healthcare. Since COVID, we have learned that some of the healthcare can be delivered with mobile homes, mobile clinics, or telehealth, what every physician did during COVID times. Probably the best option would be for Medicaid or Medi-Cal to be cover more than they cover now, and also availability of clinics.
That's important.
That's very important.
Dr. Keushkerian is my partner, and we've known each other for quite a while. Turns out, when I joined the group in 1988, Dr. Keushkerian was already here, and that's the first time that I met him. And when I met him, it sounded to me like he had a Lebanese accent in him. So I asked him, "Where are you from?" And he said, "From Lebanon." I said, "Oh, I was born and raised there too." And he looked at me and said, "Did you go to AUB?" I said, "American University in Beirut?" "Yes." And we compared notes and times, and it turns out that he was like 1 or 2 years behind me. And I never met him there. I never knew him there. And it was only when we met here in California that we suddenly realized how much we had in common. So that's how I encountered him, and it was one of the nicest moments to find out that I was joining a partner who knew exactly what my culture was and where we came from. And that's where it started. Simon sort of reminds me sometimes of Santa Claus. And he comes around and he has this joyful laugh that's so infectious. And it just melts people. I hear him when he's talking to the patients that he sees in the office. They're in the consult room and he's seeing patients, and I'm walking by and I hear them roaring with laughter sometimes. And as you hear them, you start smiling, because that's the way patients see him. They see him really as somebody very humble, very personable, and they pour out their hearts to him. I know that as a surgeon, we see patients for whatever surgery they need and follow them up, and then we say goodbye, return them to their primary doctors. But I know that Simon sometimes follows his patients for months and even years. And I ask him, why do you do that? He says, well, I've become friends with them. And I get to know their families, and they come back and we talk about other things sometimes. So that's the kind of person he is. And nobody can get mad at him because of his whole demeanor. We try to, but we can't. So I was quite pleased actually to join the group, and he's a vascular surgeon, and we do vascular surgery together. And I've watched him operate, and he is so knowledgeable in the field of vascular surgery. I sometimes go to him for advice and, what is the latest on this situation or the other. He's a very careful and meticulous surgeon. His results are ones that I would want. I'd go to him for my surgery. One of the nicest things also about him is that he goes on missions to Armenia. He's also, I think, been to missions in other places with the rest of the group. And the purpose of these missions is to bring technology, bring new surgeries, bring ideas, and serve people that are in need. Unfortunately, I haven't gone with him on any of these missions because in my field of cardiac and thoracic surgery, it's not quite mission-oriented because the surgeries are so complex, you can't do the surgeries and follow up in the space of 1 week or the 10 days that they go for their mission. But he comes back beaming from these missions, and I think there's so much satisfaction that comes out of them, that personal satisfaction that he gets, that he comes back and he's looking for the next mission. I'm honored to be his partner, and I am so pleased that he is being recognized. He certainly deserves it.
Can you please say a few words about the new advancements in surgery?
Lots of advancements have been done. Over the past 45 years, from my time that I've done my fellowship or general surgery residency training, most of us as surgeons, we did open procedures. In the last 20, 25 years, things have changed. We have done robotic procedures lately, previously laparoscopic procedures, and we have moved away from doing open procedures to laparoscopic robotic now. It is a big transformation, and to the point that some of the surgeons who were trained about 40 years ago can always claim that the new surgeons don't know how to do open procedures, but do they really need to know that? It's something that we have to learn because medicine usually is driven by technology. Once we have new technology, then all the doctors will adopt it and improve on it. As I said, in my time, nobody would have thought that we will do laparoscopic or robotic surgery, but now even I am training to do laparoscopic robotic surgery.
Parev Simonjan, you are one of my favorite people on planet Earth. We met about 12 years ago when I joined Adventist Health Glendale as the CEO. You were one of our medical staff leaders, and you were soon to be the chief of staff. I immediately appreciated and admired you. There were some major traits that over our time together, I really learned to embrace. First, you are a kind and gentle man. You're humble, you're self-effacing, but that brightness and that light shines out to all those around you. You have great skill and wisdom. First, you're an excellent surgeon, but also your wisdom comes out in many, many ways. You were our chief of staff, not only, and we had to deal with some very interesting problems, but also you joined our governing board and gave the hospital wisdom and guidance through how all of the issues around healthcare in Los Angeles. I appreciated your wisdom, your advice, and counsel, and took it often. I also have admired your endurance. You are a hard worker, maybe too hard sometimes, Simone. Anyway, that's another story. But that has been to the benefit of thousands of people over the course of your career. The other thing that stands out to me is your love. You love everyone. You love your family first. You love God. You love your patients, your colleagues, and last but not least, you love Armenia. And it shows through everything that you do to support your fellow Armenians. My memories of you are abundant, and I've shared a few pictures from our time together for this video. The thing that really stands out are the 3 trips we took to Armenia. Simon, we did that 3 times. That's a lot of time in the air. That's a lot of time in hotels. That's a lot of time in restaurants. And it's a lot of time on the ground, understanding what we can do to make things better, particularly in Neuenbergen. We made those 3 trips. We never blinked an eye. I never saw you complain. I saw you tired a few times, but always with a positive attitude, a spring in your step, and a mind to help, to learn, to grow, to give, and give more. We had a lot of fun there. We even had fun after the mission trips were over on the evenings, where you would persuade me to participate in various Armenian delicacies. Your sweet Sophie, your beautiful daughters, such an inspiration, everything you do. Also, we went to Estes Park a couple of times, which was in Maui. We got to golf together and participate in our own development and education so that we could be better leaders and better healthcare providers in what we did. I miss you, Simon. I love you, Simon. And congratulations on this wonderful honor that you are very, very deserving of. God bless you.
I've had the pleasure of being partners with Simon Keushkerian, for approximately 37 years. In fact, it's not really a partnership, it's more like a brotherly love. And we frequently joke that we're brothers from another mother, even though our cultures are completely different in terms of me being Pakistani, he being Armenian. They're very similar in terms of the love that we feel between each other. So Simon and I have known each other for over 35 years, and we've been through a lot of changes in medicine. But one thing has remained is that this person, after this many years, still is the hardest working surgeon that I know in Los Angeles. He is always ready to help, no matter what time of the day or night it is. Even if he's not on call, and I'm going down the list of people I can ask to call me in the middle of the night, I know I can depend on him to get out of bed and jump in the car and come help me. He is that type of doctor and that kind of surgeon. I've enjoyed working with him over the years. In fact, when we're across from each other on the operating table, I can look away and he would be completing my task. I mean, it's like my 2 hands are his 2 hands, and we work synchronously, and I just don't have to worry about what's being done to the patient, because I know his expertise, and I trust him implicitly with my patients. In terms of just being a human being, he's the kindest person I know. We've been on many missions together to Africa, Peru, and through hairy situations and through situations that required a lot of patience and expertise and kindness. And he's that kind of person who would go out of his way to help and be kind to patients and to be other human beings. Simon is also a great dad. I mean, if you look at how his two daughters look at him anytime that they're together, you just go, oh my God. I mean, they look at him like he's from another planet. And he in turn treats them like babies. And you can just see the love come out when he sees his two daughters. And of course, we can't forget his wife. I mean, she really is the stabilizing factor in the entire family, because if it wasn't for her, he'd still be working. And, she's the one who keeps some sort of stability and keeps him grounded. Simon also has been a great son, and I know how he's taken care of his mother, who loved him dearly. I mean, I think he was the apple of her eye, and he took care of her until her last breath. And, this is a human being that I trust with my own life, and I see as my brother. And may he have long, long, long life so that he can continue helping patients, mentoring people, and continuing to be a great brother to me.
Who are your inspirations, influences, and role models?
To answer that question, my mother had lost her husband in a young age, and I was only 6 months old with my brother. So for me, my mother always have advised us to be a professional that you can make a good living. Of course, like any other parent, she also told us either you want to be a doctor or a pharmacist or a dentist or an engineer or a businessman. So we are 4 children, and so she was successful to make one of us as a physician, the other one as an engineer, the other one is a businessman, and my sister is a food technology and nutrition dietitian. But why did I choose medicine? As I said, either your parents influence you to become a doctor, or some tragedy happens in your life that you want to be one as a physician. My father died at a young age, and I always thought that I should be a doctor. Nobody else inspired me to be a doctor, but I had a good support from my mother, my older brother, who always insisted that I should pursue medicine because I was good at it. Somehow they knew that I should be a doctor, I should be a surgeon. And as role models, I think they are the best. They were the best for me.
So it's very personal.
Yes, very personal, yes, because in life everyone has challenges, and then you have to have choices, and at the end you become a champion. And that's what happened with me.
Dr. Keushkerian, how would you describe the impact of your over 20 volunteer medical mission trips overseas, and especially to Armenia?
So we were blessed to have Grand Adventist administration sponsor us for a medical mission. And while we were in 2015 commemorating the Armenian genocide, the administration decided that for that year we should have a trip to Armenia. And the medical staff in Glendale Adventist were all excited to go for a medical mission. Initially, we had 60 people who participated in that medical mission and went to Noemberian. It was very exciting. Everybody was involved. It was a mission that nobody would have thought that it would be that successful. So much communication with locals. You become friends, family. And then what you do is minimal, but for them it was such a big change in their life. I've gone to Armenia several times, and people always ask me the same question, like, oh, you have family in Armenia? And my answer is always the same. I don't have any family member in Armenia, any relatives, but I'm related to everyone in Armenia. And that's why I go. To go and help people who are marginalized, who will never have the care that we will deliver in the places that we go, not to Yerevan, but villages, places that nobody else would have thought of going there, and helping them giving them the care that otherwise they would not have had it. It's just that it's a blessing.
What's more important than saving lives?
Thank you.
I met my husband in International Armenian Medical Society's World Congress in Lyon, France. When I saw him first, I felt that he was different. And I was captivated with his warm personality, his loving smile and kindness. After we got married, we were blessed with twin daughters, Mary and Rita, and he's been always a good father to them. No matter how tired he is, how busy he is, he always makes time for his children, his family, and loved ones. I always admired his passion, his love of helping people, not only in his local community, in homeland Armenia, and also underserved people around the world. His idea of vacation is a medical mission. Anytime I say, Simon, we're tired, let's go to vacation, he says, which country? At first, I couldn't join him because we were raising twin girls, two young children. And once they were 6, 7 years old, I started volunteering with him in his medical missions. And I remember first time when my first mission was in Peru and I was going, he said, remember, if you go once, you will never stop going, and that is true. His passion for medical missions inspired so many people in our local community, physicians and other members of our community, and our missions are getting bigger and bigger every time. He's a gift to everyone that knows him, and I'm blessed to have him in my life.
Dr. Keushkerian, how is it that the medical missions that you have participated in have been successful?
For every medical mission to be successful, you need at least 4 factors, and those include supplies. So for the supplies, you need sponsors, the space where you will go and do the medical mission, the staff, the volunteers, and also the service you will provide so that people know why you are going to the medical mission. The volunteers, very important because it's time away from their family, probably from their work, but whenever you go to a medical mission, suddenly it becomes a new family. All the volunteers are together. It's a family now. And as you work, then the teamwork becomes more important. Everybody becomes creative in taking care of issues, suddenly would show up, and then you will remember all that. And when you come back, it's a story that you can share with others, but you lived with the family, the volunteers who were with you at that time. It's a different experience. So for me, it's always challenging to go to medical mission. Although I'm comfortable to wherever I go as a surgeon, but then suddenly there's an issue that you have to think, okay, what should I do? And then suddenly you think like, oh yeah, I can do that way. And suddenly the issue is solved. That's really exciting.
Thank you for making time in your busy schedule for this sit-down interview.
Thank you, Arsharis.
It's such a pleasure for me today to speak about Dr. Keushkerian. I've gotten to know Dr. Keushkerian now for many, many years, and my first encounter with him was while he was taking care of our family members. And then fast forward, I joined this medical center about 6 years ago, and I've been able to get to know him a lot closer. So what does Dr. Keushkerian represent in our medical center, in our community, is one of the great questions that I get asked. First of all, obviously, he's a fantastic human being, very friendly, always smiling. He happens to be on my board of directors, so I have the opportunity to meet with him often and get to chat with him and understand what's working well in the hospital and what we need to work on more. And he's always been such a great advisor to me. So when we start our conversations, always tell me, Dr. Keushkerian, what's working? What are you happy about? And then we get into what are the challenges that you can share with me so I can participate and make a difference. He's been a pioneer. He's probably operated on everyone's family member in this community. When you talk to other physicians, to primary care physicians, other specialists, they always talk about him, that how he makes himself so available no matter what day of the week. He's always here to serve our patients. I want to reflect a little bit on our mission trip that we went, where I got to know him even more as a colleague and as a professional at this medical center and as my board member, that his passion for humanity and his passion for taking care of patients, it just became that much more alive when we were in Armenia and we were in Artsakh, in that hospital, that very nice hospital there. And obviously we had several surgeons with us and we had to split the operating rooms with them, but he was there for long hours helping patients. There were a lot of other caregivers and physicians around him to learn from him, so it was really heartwarming and very impressive. Further, what I can share with you is, as I said, he's on our board, and my interactions with him and our board's interactions with him, he's always the statesman. There's a lot of respect for him. He always steps in. If there's a project or an initiative, he is always there to support us. He brings a lot of the history of the medical center forward for us. And I wasn't here, but several years ago when he was chief of staff, he was asked to extend his duties. Usually they go for 2 years, but I believe his was more than that, almost like 3.5 years, and really made a mark at our medical center. At the time, he started the intensivist program, which means that we have an intensive care physician in our ICU 24/7. So none of our ICU patients are left without having an intensivist overseeing them. So that's been a huge accomplishment for our medical center and huge success factor on our quality and safety scores, which has put us on the map. We are CMS, which is the government, 5-star organization, and only 5% of the 4,500 hospitals in the nation have a 5-star. And this week, we received our 5th 5-star rating, 5 years in a row at this medical center. So one of the elements there, I'm always told that it's the intensive care program that is so robust and it catches people's illnesses so on time, and our physicians are able to mitigate so the patient doesn't deteriorate. So that's one of our great successes, and he was the pioneer on that. So from my perspective, being a CEO of a large hospital in this metropolitan setting, having a large Armenian community that we're serving, it's such a blessing and such an honor to have Dr. Keushkerian being one of our physicians, one of our surgeons, and also one of our board members. Thank you.
For advertising on Insight TV, please call 818-653-0199.